which I understand was the fifth attempt to get funding for this research. What is the research project and who would it have benefited?
So I'm a paediatric emergency doctor, and one of the things we see a lot of are kids with asthma. Most kids with asthma do well with typical inhaled treatments, so some Ventolin puffers and some oral medications, but there's a group of kids that are pretty sick with asthma and need intravenous treatment. Unfortunately, in Australia, or globally, we actually don't know which intravenous treatment to give. So what we're trying to do is do a randomised trial comparing kids who are sick enough to need intravenous treatment with the two most common treatments that we give in Australia, magnesium and aminophylline.
Okay, so the fact that this would have been funded through the Medical Research Future Fund and it's not, does it mean you can't do those randomised trials to the extent that you'd want to do them?
The problem with paediatric research, and particularly acute paediatric research, most kids aren't that sick. So in order to find enough children, we need multi-centre research. So I chair something called the Predict Network, which is an across Australia and New Zealand to look after all the major paediatric emergency departments across both countries. And in order to do a big study like this, you need over 1,000 children. And to do that, you probably need 18, 20 hospitals involved. So you can't do it in a single site. It'd take 50 years. So in order to do it, you need enough money to be enrolling patients in all of the different sites.
So this research was really about scaling something so that you've actually got a scalable kind of test, I guess, to then look at it across Australia and New Zealand.
Yeah, and that's common for a lot of paediatric critical care illnesses. Just most children are fine, but the ones we really worry about, we don't see very often. So in order to do that properly, you do need 15, 20, 30 hospital studies to do it properly.
So one of the recurring themes in my discussions with our researchers who have been successful in previous MRFF attempts, but and not in the ones we're talking about, is we're talking about pretty small amounts of funding that you're actually applying for. We're not talking about hundreds of millions of dollars here. So for your grant, how much money were you seeking for your grant, and what's the reaction? You talked about having teams of people working across New Zealand and Australia. So it's not just you that's not getting the research grant, it's a team of people sitting behind you. What's the reaction for what really is a relatively small amount of money in the scheme of things, which can save lives? And there's not really an explanation to why you're not getting that funding.
Well, the grant we were looking for was between $5 and $6 million, and that would cover enrolling medication manufacturer and employing research nurses at all the hospitals we wanted to get going. So $5.5 million sounds like a lot of money to me, but in the context of research funding, it's not an enormous amount. One of the things that we know is that you cannot do this without the funding. You just don't have the infrastructure to follow up the patients, to get good data, to make the medications so that we don't know which ones we're giving, to make it a really strong trial. So without the money, you just can't do the study. So we apply for a grant with an optimistic approach to say, well, if we get the money, we can do this. But without the money, we just can't do it at all. There's no chance of doing it.
And so do we risk falling behind in terms of the global picture? All research is global and collaboration is global. Are we at a sort of standstill point in your area of research if we don't do this research?
I think we're quite lucky in Australia. We've a very cohesive network of paediatric emergency departments that's been around for more than 20 years now. We've done lots of big trials and big observational studies. There are similar networks in other parts of the world. Acute asthma is a global research priority. There is a research network in the UK that's just starting up a study, but they give the drugs in a slightly different way to us. There's a research network in the US that's setting up a study. They give it slightly different again. The only way we can inform the care that we're giving to the children that we're looking after is to do this study in our backyard. We can't rely on the stuff that's done elsewhere because there are lots of reasons why medicine's practiced differently in different parts of the world, but we can't do the work locally. We're not going to be able to inform our care.
So are you continuing to knock on the door?
Absolutely. I submitted another grant for this yesterday, so fingers crossed.
Fingers crossed. Fantastic. Yeah. Thank you.